Hello everyone, welcome back to our Fire Nursing Tutorial YouTube channel. Who have visited first time on this channel, please do subscribe. We'll discuss important MCQs in this class. We'll see the first question. Which of the following statements indicates that the client with a peptic ulcer understands the dietary modifications he needs to follow at home? Options are here. Right option is D. Should avoid alcohol and caffeine. Second question. The client with a NG tube begins to complain of abdominal distension. Which of the following measures should the nurse implement first? Options are here. Right option is C. Check the function of the suction equipment. We'll move to the next one. The nurse is preparing a teaching plan for a 45 years old client recently diagnosed with type 2 diabetes mellitus. What is the first step in this process? Options are given. Right option is C. Assess the client's learning needs. Next question. Multigravida client is scheduled for a percutaneous umbilical blood sampling procedure. The nurse instructs the client that this procedure is useful for diagnosing which of the following? Options are here. Right option is C. That is Harish disease. We'll move to the next one. Which of the following is an adverse effect of vancomycin and needs to be reported promptly? Options are here. Option is B. Tinnitus. We'll move to the next question. The nurse assesses a client with diverticulitis and suspects peritonitis when which of the following symptoms is noted? Options are here. Right option is B. That is rigid abdominal wall. Next question. The nurse should assess the client with severe diarrhea for with acid-base imbalance. Options are here. Right option is C. That is metabolic acidosis. Next question. A 6 years old with cystic fibrosis has an order for pancreatic replacement. The nurse knows that the medication will be given. Options are given. Right option is B. That is with the meals and snacks. We move to the next question. A client with diverticulitis is admitted with nausea, vomiting and dehydration. Which finding suggests a complication of diverticulitis? Options are here. Right option is B. That is bird-like abdomen. Next question. A client with schizophrenia is receiving depot injections of haldol deconate. The client should be told to return for his next injection in. Options are given. Right option is C. That is 4 weeks. Next question. An elderly client is being admitted to same day surgery for cataract extraction. The client has several diamond rings. The nurse should explain to the client that. Options are here. Option is B. She will sign a valuables envelope that will be replaced in safe. Next question. The nurse is preparing to administer blood to a client who requires post-operative blood replacement. The nurse should use a blood administration set that has a. Options are here. Right option is A. That is micron mesh filter. Next question. A client with severe major depression states, my heart has stopped and my blood is black ash. The nurse interprets this statement to be evidence of which of the following? Here are the options. Right option is C. That is delusion. Please like, share and subscribe to my YouTube channel for more informative content. Thank you for watching.